The 33-year-old, the worst child serial killer in modern British history, has been found guilty of the murder and attempted murder of 13 babies, but did not appear in the dock to hear her sentence. Well, joining us now is Dr. Dewi Evans, a consultant paediatrician who advises on child safeguarding issues. Very good of you to join us. Thank you very much indeed.
Yes, now Dr. Evans was one of the independent medical witnesses for the prosecution, and his evidence was instrumental in its case against Lucy Letby. Thank you so much for joining us, Dr. Evans. Just how much of the trial did you participate in then over the past 10 months?
I was there for the whole of the prosecution, so I was there from week 2 to week 24, and I listened to all of the evidence from the local doctors and the local nurses. I was there for a total of 102 days, and I gave evidence for 16 of the 17 babies.
Just in terms of that, it must have been incredibly chilling for you as a clinician to listen to what happened, to the evidence. I found it incredibly hard to listen to what I heard, but also just in terms of pattern recognition. This went on between June 2015 and June 2016. Consultant paediatricians continually raised the alarm about what was going on this neonatal unit. And it seems to me that many of those alarms were completely disregarded by management. And I've heard all of these warnings that came from people like Stephen Brearley, from Ravi Jayaram, and they felt that they were not in a position where the management were listening to them. In fact, the management actually said this case is closed. That must have been incredibly hard to hear.
I think it's absolutely shocking to hear this for the general public. It's shocking to me, actually, but it's not surprising. I've dealt with legal issues involving children for over 30 years as an independent paediatric witness and dealing with clinical negligence. And I'm sorry to say that sweeping it under the carpet, the cover-up, is the default position of managers within the NHS.
And why is that? Is it because they're so worried about safeguarding the NHS trust above everything else? I spoke to a couple of consultants this morning, friends of mine, people I train with, and they say they are met with this constantly, where if you as a clinician raise concerns, the management simply do not want to listen.
I think it's quite simple. I think they're putting their own interest ahead of the interest of the public and ahead of the interest of the first-line staff, our doctors and nurses. They're looking after their own backsides first. I think it's as simple as that. And most of the time they get away with it. And I think it's been easier for them to get away with it over the past few years because the general public has little or no access to independent opinion. Community health councils have been abolished. That was a disgrace, and that's made life more difficult. Legal aid for families whose loved ones had allegedly been damaged by clinical negligence, that's been abolished. And most worryingly of all, there is this attitude of bullying and intimidation of medical staff who are prepared to confront management and say, look, the service is not safe, we are concerned. And I know of a number of people, including paediatricians, who have had their careers destroyed because if you persist in being a difficult person, then you will be charged with intimidation or bullying of management. You have no defense at all. And of course, the NHS is a monopoly. And if you cannot work in the NHS, you cannot work anywhere unless you work abroad. And this is something that has happened to people. And I know of people in South Wales who've had their careers destroyed by bullying management. And the same applies across England as well.
Now, Dr. Evans, this case will understandably have caused some concern for young parents or soon-to-be parents, pregnant women who perhaps are currently on neonatal wards with their young babies. What can we do? What reassurances are there that child safeguarding policies do work and actually that this was a very, very rare case indeed?
All right, you're not coming... Sorry, I'm not hearing you very clearly.
Oh, sorry, we seem to have lost you there. Can you hear me now?
Yes, that's better.
Yes, I just wanted to ask you what kind of reassurances we can give to young parents who are concerned in light of this case about the safety of their children in paediatric wards.
Well, for a nurse or a doctor to deliberately harm a baby, Lucy Letby, Harold Shipman are the worst examples. That is incredibly rare. You will get occasions where a nurse or doctor who is deemed to be not good enough to do the job, that is a risk, but usually a colleague will pick up someone who's not up to scratch. What is more concerning is that mistakes usually occur because of systems failures. There is no line of command from consultant to junior doctor to most junior doctor, for example, or you get fallings out between doctors and nurses and disagreements, in other words, personal disputes. Those kind of things occur. May happen, but the main problem within the NHS is that the systems break down. In other words, there is lack of leadership, and the problem with that is that managerial structures have overtaken medical structures in terms of care and practice, and I think there's too much emphasis on looking after the pennies, a disregard for clinical concerns, and we need to get a situation where managers should be accountable to doctors and managers should be accountable to patients and not the other way around. So management in the NHS is really out of control. And I think beyond this particular trial, I think the problems we are seeing in the NHS, particularly in England currently, where you have junior doctors going on strike, nurses going on strike, senior doctors going on strike, it may be about money, but it's more than that. It's about demoralization and the fear that things aren't working as well as they should be and that nobody is listening.
I think that's the nub of it, isn't it? That is absolutely the nub of it, which is clinicians feel that no one is listening. And I hear this repeatedly from my friends and colleagues, that when people speak out, the management ignore them. Now, surely what we need to do is to make sure there is a professional body that oversees these managers. At the moment, it's a free-for-all. It's the Wild West. And you can move on. There's no accountability whatsoever. I look back, actually, in the British Medical Journal, which obviously you read and I read, back in 2013, doctors were calling for bodies to be set up that oversee these clinical managers.
Yes, I think they need a regulatory body. I think they need to be subject to interrogation from representations of the public. I think one issue that is chronic within the NHS is the democratic deficit. Chairman of the health board are appointed by politicians. The non-executive people are appointed by politicians. The public, despite paying for every pound that goes into the NHS, has no direct control over who these people are. And of course, if you're appointed by politicians, you end up feeling accountable to them and not to the general public. So, quite frankly, the current system of chair of the health trust and non-executive directors is a complete waste of time and a complete waste of money. It does not work, and we need to empower those people in need, i.e. patients, instead of empowering those people in control, which is what you expect in an authoritarian society, not in a democratic society. And the NHS runs very much like an authoritarian state and not like a democratic state as we speak.
And of course, Alison Kelly, the Director of Nursing at that time, has now been suspended. Let me ask you the same question I asked Joshua Rosenberg. Do you think that instead of being a non-statutory inquiry, this should be a public inquiry? The reason I ask that, because it has more teeth, they can compel witnesses to appear. My concern is managers will disappear. We know that many of those managers have left the country or indeed retired. They're on massive pensions. Should they lose their pensions?
No, we need to move from a blame culture to a responsibility culture. And what we have here is a lack of responsibility, a failure of responsibility. We certainly need a statutory inquiry where witnesses can be summoned, give evidence on oath, and all of this should be publicised, should be in the public domain. If that doesn't occur, then I would suggest that the government would be seen to be wanting to be seen to be doing something than actually seeing something. Because after all, this is not the only or the first scandal within the NHS over the last few years. It's one of many, and nothing seems to change from one so-called scandal to another. So whether there is the will there to change things, I don't know. There are certain things that could be introduced immediately in terms of setting up a regulatory body for managers. I think that it would be politically a good idea to have the same system you have for the police, where you have police commissioners elected by the public and have chairman of health boards elected by the public instead of by politicians. You know, you could do that at the same time as local authority elections. Wouldn't cost very much, and the accountability would then, I think, move towards responsibility to the public and to the patients. And the same applies to, there has to be a completely independent organisation that patients feel secure in addressing their problems. And also the same situation should apply to doctors and nurses. You know, doctors should not feel that by raising concerns that they are placing their careers at risk. But over the last few years, we've had a catch-22 situation within the NHS. Those medical and nursing people who I would consider are very good are seen as a threat by management and therefore do not end up in executive positions, whereas the ones who do end up in executive positions are the yes people who are willing to do as they're told.